Welcome to the deep dive. Today, we're getting into something that's, well, everywhere now, digital tools. But we're looking specifically at how they're really changing clinical health and social care research right here in the UK.
Yeah, it's a massive shift. And it impacts, well, pretty much all of us eventually through new treatments and better care.
Exactly. So to really get under the hood, we're drawing on this detailed study, a mixed methods one, published just this year in BMJ Open.
Right. It used online surveys, but also, importantly, in-depth interviews.
Yeah, talking to the people actually doing the work, researchers, R&D staff across the UK.
And our mission here really is to understand what it's actually like using these tools day to day.
Yeah.
What works, what are the real headaches.
And where do we go from here? What's the best path forward?
Precisely. It's about the tech, sure, but it's more about how we fundamentally do research now.
Okay, so here's where it gets really interesting. The study points out how the COVID-19 pandemic was this huge, unexpected catalyst.
Oh, absolutely. A massive accelerator.
It basically forced a shift from face-to-face to remote research almost overnight and kind of proved, in a real-world way, that, hey, this digital stuff can actually work.
It really challenged some long-held assumptions, didn't it?
Yeah.
That you had to be in person.
Totally. And when the study says digital tool, it's pretty broad, right? Basically, any IT thing or online platform that helps with any part of the research.
Yeah, and the range they found was fascinating. I mean, it wasn't just complex, specialized software.
Yeah.
No, think about recruitment people using social media, data
Mhm.
collection through, standard online surveys, even using Microsoft Teams for interviews.
Great teams. Interesting point about that one.
Well, yeah, because for managing studies, you had everything from like basic Excel trackers up to Power BI for analytics, DocuSign for consents. But Teams, it was funny. Some people listed it as their most effective tool, and others listed it as their least effective.
Wow. So it really depends on the user, the context, maybe training.
Exactly. Highlights how it's not just the tool itself, but the main reason people use these tools, overwhelmingly, it was to reduce time, increase efficiency.
Makes sense. And they rated the tools they found most effective pretty highly, didn't they? Like 8.1 out of 10 on average.
Yeah, pretty good endorsement when they work well.
So let's talk benefits. For the people taking part in the research, the participants, what were the big pluses?
Well, the obvious one is convenience, not having to travel.
Yeah, huge. Especially if you live far away or have mobility issues, it just opens up research participation to more people.
Definitely. And flexibility, too. Things like using chat functions for quick queries or getting study materials in different languages easily online.
That's a big step for inclusivity, isn't it?
It really is. And for the research staff, what did they gain?
Efficiency again, right? Cutting down on admin tasks, paperwork.
Less drudgery, but also better connectivity. Colleagues could work together much more easily across different sites, different cities even.
Which must have been a lifesaver during the pandemic lockdowns.
Absolutely a game changer then.
Okay, so benefits, yes. But it wasn't all smooth sailing, was it? The study found some pretty significant downsides, too.
Right, and this is critical. The issue of digital exclusion.
Ah, yeah. The worry that going digital leaves some people behind.
Exactly. It raises serious questions about equity. A study mentioned concerns specifically about older participants, maybe people less comfortable with tech, or those without reliable internet access.
Or maybe people worried about clicking on links, legitimacy concerns.
That too. Very real concerns. And then there were the practical, technical barriers, just poor internet connection sometimes or systems crashing.
And the need for digital skills, right, which isn't always there, especially for, say, busy clinical staff like nurses.
Precisely. They might not have the time or the specific training needed to use these tools effectively on top of their main duties. It requires resources.
So given all that, the good and the bad, what did the study suggest for the future? How do we get better at this?
Well, one key finding was that staff often didn't really choose their tools strategically. It was more like using whatever was already available or what they heard about through word of mouth.
Kind of haphazard.
Very much so. So recommendations included developing something like a checklist database.
Okay. To help staff pick the right tool for a specific research job.
Exactly. And maybe a central hub for sharing case studies. This tool worked really well for this kind of study.
Sharing best practices.
Yeah, and fostering networks, maybe local or national ones, to share that digital expertise because it's often quite fragmented.
So it sounds like a real call for more structure, more guidance.
Definitely. Moving away from just stumbling upon solutions and to tackle the barriers, especially exclusion.
What did they suggest there?
Practical things like
Yeah.
offering a hybrid approach, digital and paper options so people can choose, or providing physical locations like a library or clinic where people can access the digital tools if they don't have them at home.
Right, bridging the gap.
hmm And critically, it stressed the need for real collaboration between the digital experts and the clinical staff before tools are rolled out, making sure they actually fit the real-world workflow.
That makes so much sense. You need both perspectives.
You really do.
Wow. Okay, so this deep dive really paints a picture of both the huge potential and the real challenges of using tech in health research.
Yeah, it's a powerful stuff.
Yeah.
But it comes with responsibility.
So thinking bigger picture then.
So yeah, if you connect this all up,
Yeah.
just imagine how much better, how much more equitable clinical research could be if, starting now, every new study really thought about how to integrate digital tools properly.
With a clear plan for overcoming those barriers.
Exactly. Focusing explicitly on making it inclusive for everyone, not just assuming digital first is always the best approach for all. What happens when we truly commit to bridging that digital divide in how we discover new health solutions?